Well, one of the things I love about you is that you really are very focused on that there's no fountain of youth. It just doesn't exist.
Nope.
It doesn't exist. And we're all supposed to get
Unfortunately.
older. And we're all supposed to have expressions and have emotions, making it sort of last and be fresh for as long as possible. Absolutely. But we only go in one direction. And this whole idea of like, we're going to reverse aging and it's going to go backwards and you're going to look like you're 20 years old, you're just going to look scary.
We are 100% with all these procedures fighting nature, and nature's going to win this battle in the end, and we have to kind of let it win it gracefully. We're going to slow it down.
But the word is graceful.
Yeah, this is not a fight you're going to win against nature.
Being a mom is the toughest job there is, and it doesn't come with instructions. So it's okay if you don't have all the answers. We'll figure it out together. This is Mom Brain with Ilaria Baldwin and Daphne Oz.
So I'm Dr. Arash Akhavan, board-certified dermatologist. I founded the Dermatology and Laser group here in Midtown Manhattan, and together with my business partner, Alyssa Di Benedetto, have the product line Skin NYC. It's been a pleasure to be here.
So beginning of the summer, I've been hearing all of these things about the toxicity of sunscreens. And I've been like on every single website trying to read ingredients lists and everything. What is safe? What is not safe? What kinds of brands, if you feel comfortable, what kinds of brands should we be buying?
Sure. Yeah, so the FDA issued a warning. It was a warning that was a little late coming. We kind of all knew a lot of the things that they were going to put in this warning statement. And then it was picked up by the popular media, thankfully, so it got out there, which I'm happy about because it's stuff I've been telling my patients now for years, actually. The good news is the two very bad ingredients aren't really found in sunscreens in the U.S., so the two that they said to avoid. So you don't need to worry about that right off the bat. Then there was a bunch of very commonly used sunscreen ingredients that, like oxybenzone, for example, that they said we should exercise some caution about, that not enough data exists. And we've known for a while now that some of these can be hormonally active potentially if you were to have them internally. And for a long time, we've been saying, yeah, but you're just rubbing small amounts on your skin.
Right.
What was shocking is the new data that's showing so much of it is absorbed into your blood. So it's a lot higher blood concentrations than we were expecting. And this is especially true if you're using enough of it and you're reapplying the way we're telling you to reapply. And it becomes even more of a concern if you're putting it on the little people in your family because they have so much more absorption with their body surface area. Sort of short answer of what's safe, kind of what I've been telling my patients all along, stick with mineral sunscreen, so zinc and titanium. And there's lots of great products. If you were to use zinc and titanium mineral-based sunscreens 10 years ago, they would be disgusting. They would be sticky. You'd end up looking pale as a ghost. They're getting better and better. They're becoming more cosmetic grade. They're going on sheer. They're not going on super sticky. They're coming out with tints, so you can pick the tint that's appropriate for you, especially if you're putting it on your face. So that's kind of the what I would stick with at this point until other ingredients come out. And other ingredients probably will come out in Europe. They have other ingredients that they use that aren't yet FDA approved in the U.S., so we can't buy them here, that are safe in sunscreens. As far as like brands to look for, some of my favorites, I always tell my patients I love MD Solar Sciences. If you go to their mineral section, they have lots of options. They have moisturizing, not moisturizing, face, body, for kids, for adults, the kids being no sting formulations. Won't sting when it gets in their eyes. So I really love that brand. Blue Lizard is another brand I really love, especially for kids who are active. And it's great. It has very few added ingredients in it, so it's great for sensitive skin too, so great for children. But the popular brands that you could buy in CVS or any drugstore, Duane Reade, your local drugstore, they are all coming out now with purely mineral-based versions. So you can look at Neutrogena. They'll have, usually the word pure is involved, so I think it's Neutrogena's Pure and Simple or something like that. Aveeno has a pure. Coppertone now has one Pure, which I think is newer. So you don't necessarily have to go to like super expensive, pricey brands. You can definitely find drugstore brands that are zinc based as well.
And how do you know, like, how often should you reapply?
About every 80 minutes is usually the...
That's what I find to be so hard, I mean, especially because I have so many kids.
Yep.
It is really, really tricky.
It is so annoying. So one thing that you should kind of consider is trying to use barriers as much as possible and use the sunscreen only for the uncovered areas. So my children are still young enough that I can kind of force them into swim shirts, and it makes it that much easier, and hats and sunglasses, and you just kind of quickly do their legs and you're done.
Right. No, it makes a difference.
Yeah.
So Leo is my super sensitive baby. He gets like eczema, and we have to use very, very natural products with him that have very few ingredients in them. And and he's also very fair compared to the other ones. And he's like in a rash guard and like the long shorts, and like his head is covered, the poor thing.
It makes it so much easier for the parents, honestly, also. I mean, the reapplication is so important, and I'm a dermatologist, and time will fly by and I'll be like, oh, it's been 3 hours,
Right.
It's hard.
Well, and also, chasing them around once you get to the beach, and then like putting the sunscreen on the sandy skin on the beach is like horrible.
Yeah.
And then also you think, so worried about these different ingredients. The more that you just cover their bodies, the less of the sunscreen you have to put on them, and then the
Exactly.
fewer things that we're sort of concerned about we have to.
And other things like, if it's practical, going out earlier in the morning, later
Right.
in the day, using umbrellas, things like that, obviously help as well.
Now, I use a sunscreen, a tinted moisturizer in the morning that has a sunscreen. And because I don't burn, I literally don't burn, I'm really bad at reapplying. And it was this thing that as I was younger, I'd be like, all right, you know what? I don't burn, so I'm not going to have a problem. That's not true, right?
That is not true. So it's true that getting a burn is the worst thing you could do for your skin. But anytime your skin is changing pigment, there's enough ultraviolet rays getting in that's causing a little bit of DNA damage as well. So that's going to lead to premature aging. It's going to lead to sunspots, and it's going to lead to skin cancer.
Great.
One real thing.
Great. Sounds good for me.
There's a couple of products that have come out that I really like for women who wear makeup, because that's another thing that I always hear is, I have my makeup on, I'm not going to reapply sunscreen.
Right.
I don't know if you've seen them, but there's a lot of great like powder-based, zinc-based sunscreens that you can just kind of touch up your sunscreen. That's the main point of them.
I just found them like last week. It's
Right.
interesting that you're bringing that up.
Yeah, there's a color, I think one's called Color Science. That's a very popular one. I think you can buy it in
Amazon.
almost any, Amazon. I think maybe Sephora. Isden is a company out of Spain that has great cosmetic products, and they have a mineral-based sunscreen you can touch up with. So there are good options to carry in your handbag and just kind of quickly touch up sunscreen.
Oh, people always say to me, wow, you're so lucky you don't burn. You don't have to worry about it. I'm like, actually, I'm realizing as I get older that it's not, because the burn reminds you, the fear of the burn reminds you to reapply. Whereas
Right.
I'm thinking so much about my kids.
Right.
But then you get yourself into the place where you're like, oh, I'm worried about aging, and I'm worried about moisturizing and all of these different kinds of things. And what I'm learning is that you can do so much just by preventative care
Yep.
of really just taking care of yourself. Now, I'm somebody who I get a lot of freckles in the summer, always on my nose. And it's always it's this funny thing in the house that no matter, Alec and I have now been together for like a really long time. I don't know, like 9 summers maybe at this point. And he'll say to me every single summer, you have freckles. And I'm like, you say this to me absolutely every year because they only come out in the summer.
Well,
now,
at least he's not calling them sunspots.
At least he's not calling them sunspots, right? Is that what freckles are, like tiny sunspots? But then they go away.
Yeah.
How is that possible?
So you just don't have, luckily enough, sun damage yet that they're permanent sunspots.
I love that you said yet.
Yeah. Well,
Yes.
it happens to all of us.
He's like, let
eventually.
me predict it for you
Yeah.
with a crystal ball.
Hopefully never for you, but for most of us, eventually you start to develop some sunspots that stick around even in the winter, and they keep getting progressively worse year after year. And I'm sure if we could show anybody a picture of what they're going to look like when they're 72, that would be a great incentive to make them wear sunscreen every day and reapply and all that.
So what are things, I mean, I've learned a little bit from you. You are like my skin guru. I've learned from you over the years of there are things that you should do before the summer, and then you take really good care of yourself and don't do, in terms of like these different like laser facials and all these kinds of things. And then after summer, is there something that we should be doing to kind of cleanse our skin from all the damage we've done?
Yeah, so a lot of the procedures that we call resurfacing, rejuvenating, that's what they're doing. They're taking damaged skin and replacing it with new, fresh skin. So there's basically fractional resurfacing lasers. There's 100 different types of them. In our office, we use the Fraxel, Resurfix, PicoSure, a few of them. They all work on the same premise. You're creating little tiny micro-injuries in the skin, which induce new skin formation. So out with the old damaged skin, in with new, fresh skin. Definitely going to see improvements in terms of pigment issues and sunspots, that new skin generation's generating collagen, so you'll see improvements in your skin texture and fine lines. And there have been some research showing that it probably protects against skin cancer as well, to some degree, because you're replacing damaged skin with new skin. So that's a great thing. Other options, if lasers aren't available to you, the fall is a great time to do chemical peels. Same process. You're applying an acid into your skin to get that same
what's better,
thing.
to do the laser or the chemical peel, or is it just different? Because I feel like for me, there's so many different options out there, and it's confusing.
Yeah, my 3 sort of rejuvenating categories that I think of in terms of the surface of the skin are chemical peels, microneedling, lasers. That's kind of the order of effect, with laser being the best, followed by microneedling, followed by chemical peel in terms of effect. Now, there's cost considerations that go into it. There's downtime considerations that go into it. A chemical peel is going to be relatively inexpensive, but you're going to have peeling. So for a week, you're going to have to deal with that.
That, by the way, I know because I let you give me a chemical peel. And it was so funny because, I mean, I am a pretty low maintenance kind of person, and it was funny. It was my one and only time that I've ever done a chemical peel, and then for to like 2 weeks, your skin is peeling.
Right.
But you said that if you go back and you do it again, it's not as scary.
Right. So the first time is always the worst with a chemical peel, just because you have so much dead skin that's built up, you don't even realize it.
From all those years of me not reapplying my sunscreen.
And then, the second time you get it, a little bit easier process.
But how often should you do them? If you're like really on top of it.
You can do it as often as once a month. I mean, that would be excessive. That would be for safety. You could do it as often as once a month. I would say a few times a year, 3-4 times a year. If you want to really be on top of it, would be a good number to go for.
And what about these like do-it-yourself at-home chemical peels? Because I know people who do that, and everybody comes out of the woodwork once people are like, "Why is your skin peeling?" I'm like, "Oh, I did a chemical peel," and they say, "Oh, I do one every single month at home."
Yeah.
They'll tell me this, and I'm like, "How is that possible?"
Yeah. So with all those at-home things, it's kind of fine until it isn't. So 1,000 people are going to do it, and they're going to be fine, and then it'll just take that one person. And I, of course, see all the horror cases. I'm seeing a person with scarring, like deep, severe, emotionally distressing scarring from an at-home chemical peel. And then that little procedure that they did for that minor sort of tweak or beautification, I'm going to be treating now for 2 years with lasers. It's going to cost thousands of dollars, and
they'll never be the same.
And it may never get back to where it was. So you have to kind of be careful. There's I see on Instagram all these scary things. People now doing their own filler that you can buy on Amazon, believe it or not.
No.
I mean, it's just so scary, and it's fine until they get a horrible infection.
I mean, that's the thing is that, I mean, going to somebody who is good, it's worth it in the long run. I mean, you can look at the different prices out there, and if it's something that you're interested in, when it comes to your body, your health, your face, you don't want to be taking shortcuts because it could be really bad.
And the thing with all these cosmetic procedures, they become so readily available that now a lot of people are kind of equating them with because it's all for cosmetic improvement, you're equating it with makeup or hair or something like that, where hair is very important, but you can just get another cut in a few months, or your makeup you can
do
take
a
off
deep
and
conditioning
you're
treatment.
right. You can take off your makeup and try
Right.
again. Versus a filler can actually, if improperly placed, can make you blind. That's a permanent thing. It can make you permanently disfigured. So there's a reason why
You go to medical school.
you've had 12 years of training in these
Right.
things. So it's not something that should just be picked up by somebody just because they took a weekend course or they watched a YouTube video and they think
Right.
they know how to do it.
Yeah, no, that
Right.
YouTube video makes it. Whenever I watch YouTube videos of cake making, and that's like my favorite thing to do. I
Right.
feel like I could be a baker, and then
Yeah.
I try to make a box cake from like the bodega, and it's like disaster. I'm like, okay, let's leave it to the pros. Okay, so wait, I really want to recap. Before the summer, what do we do to our skin?
So before the summer, you can do things to prepare for the summer season. So you want your skin kind of having as minimal sun damage as possible. So some of the same procedures we do after the summer apply before the summer as well. Popular things that people will do just because they start thinking bathing suit season will be taking care of leg veins, taking care of like little skin imperfections that have been hiding under layers of clothing. Obviously optional things that people can do. If you are interested in doing things like laser hair removal, that's better to do kind of plan ahead way before the summer. It's going to take multiple sessions. There are certain things that we prefer to do before the summer season, before you're getting a little bit more outdoor time.
Well, because also, correct me if I'm wrong, the way that a laser works is it reads the color of your skin and then reads the hair follicle, and then it attacks, or for lack of a better term, it targets the hair follicle. So the more contrast you have between the hair and the skin, the more it works, correct?
That is correct. So the laser is attracted to melanin pigment. It's attracted to the color black. So your hair has to be closer to the color black than your skin, and it's going to be attracted to your hair follicles then more than your skin. And it kind of takes the person who's setting the laser settings to be sure that they've set it correctly so that they're only being attracted to the hair follicles and not your skin at all, so you don't get a burn. The more contrast there is, the higher we can turn the settings, the more effective the treatment will be.
Now, I have done laser hair removal with you, which was like life-changing. And when I started going to you, I mean, I've been going to Dr. Akhavan for like a long time now. We've known each other a while. You didn't have the painless one.
No, it used to be quite painful.
It was painful, but
Yep.
you know what? I was like, no numbing cream. Let's just
I know
do
you
this.
being into your natural approach to everything.
Well,
Wanted
it's
to
about like
experience it
I'm
all.
a pretty low maintenance person.
Yeah.
We're talking about cosmetics, and
Yeah.
I'm really going to say I'm a pretty low maintenance person. So I was like, let's not take the 15 minutes they need to put the cream on.
No,
and
I
then
remember you'd come in and I'd be like, really? Can we just put a little bit of numbing cream on? You're like, nope, let's go.
But I was tough,
Yeah,
right?
you
managed
were
it.
always fine. Yep.
But now you have one because like every once in a while you have to go in for little touch-ups.
Right.
And so I have experienced the painless one,
yeah.
which is like really incredible. How does that
It
work?
is pretty amazing. So it's this new laser came out last summer called the Modus AX. It's this laser that works instead of giving you all the energy in one pulse, it breaks that energy up into tiny little packets that are very rapidly delivered, 5 times per second. So it adds up to actually even more energy than we used to give with the old laser, so more effective than the old lasers. But because it's in these tiny little packets, you're not going to have that sort of sudden heating of the skin, which is that
Right.
burning sensation you feel with laser hair removal. It's been so popular. I mean, that was, I think, the biggest sort of impediment to people getting, like, that's why people
is
don't want laser
painful.
removal. It is so painful.
Well, especially when you do your legs, because the legs are a big surface. Like,
Yeah.
you do underarm and you do, bikini, Brazilian, whatever shape you like. And that's like, it's a very small area.
Right.
But like the legs, it's a whole process, and you get sort of fatigued during the process because it hurts. And with your
Yeah.
legs, you can't put the numbing cream, correct?
Not on the entirety of the legs. It's too much surface area,
It's too
so
much
it's
surface
dangerous.
area.
Yeah.
But I have to say that, it was really life-changing for me to do particularly my underarms and bikini area because, no matter so first of all, like with the waxing, every 3 weeks you have to do it or something like that. And your entire life is just it's just hair regrowth. And it's not like you have no hair for like a few days and then it's just like sprouting again.
Yeah.
And so to do this, it was just really, really incredible. And it was you at the beginning who taught me that actually shaving, which I was told that don't ever shave, was better. Because I had been waxing for okay, maybe I'm wrong, but this is the way he's looking at me. He's like, I don't think I ever said that. He's like, no, incorrect.
I'm very curious to hear this.
Okay, so this is what you're saying. So this is my Brazilian waxing confessions. Okay, so I was waxing for so many years. I used to do it myself. I couldn't afford to go and get it done. So I would be like a teenager and I bought like the little kit and I literally would give myself a Brazilian with like my leg up in the air. And I tell people this and they're like, oh my God, I can't imagine doing that. But I was, very committed.
Gotta do what you gotta do.
I was very committed, so I did it.
Yep.
And then I had been doing that for so many years. And then when I got to you, it was this thing of like, because I'd been ripping out the hair follicles, the laser, those ones had to regrow in order for the laser to get.
Yes. Okay. I remember what you're talking about.
So I had to shave for a while and not
Yeah.
wax.
In order for laser hair removal to work, you do have to stop waxing because there has to be a hair root there for the laser to actually work on. So I don't think in general that waxing or shaving one's better than the other necessarily. One may work better for one person and they'll get more ingrowns, whatever works for any person. But once you start the laser hair removal process, you can't wax anymore.
Okay,
you can't wax, you can't thread, you can't pluck.
We came to, I've been telling everybody for years, just shave, don't wax. Dr. Akhavan said so. Apparently not true. Apologize to all the people who have been shaving for years.
No, you need to have a hair follicle there for the laser to zero in on and take care of. And I mean, honestly, with the painless laser, it is really great. There's obviously, it's not cheap, but in the long run, it's much cheaper than waxing.
You think about that. Like if you are really on top of it, I mean, it's one thing if, you're somebody who every once in a while you will, go for a wax. But if you're doing this regularly, it really is cheaper in the long run because by the time you wax, leave a tip, that whole thing, get there, go back to your home. I mean, it starts to really add up. Yep. And then you're thinking, okay, well, I want to be, without hair in whatever area you're choosing. And then within a few days, it's growing back. So it was one of these things that just made such a difference. especially like I think for women with their underarm area was something that people see all the time. And just to not have this hair there, like I have to shave every single day, or or even the shadow, even when you shave and there's still that shadow. It's amazing to just literally not have it.
Right. I mean, that's what my wife always tells me. She's like, it's such a time saver.
It's such a time saver, which is interesting because I still take the time to shave even though I have no hair there. It's like just like it built in me.
Exfoliating, I guess.
Exfoliating. I have to bring my razor. Exactly. I have to bring my razor everywhere. My husband's like, you have no hair. And I'm like, oh, you know what? Whatever. I've been doing it since I was, a teenager. I can't stop doing it. I mean, it was just like literally putting the razor over. But no, I really do think that out of, everything that I've sort of learned about and over the past few years, the laser hair removal is really, really like a big change. I remember you said to me right before you were going to start, you're like, now you do understand that this is permanent, like it's not going to grow back. And I'm like, do it. But there was that like last minute, are you sure about this? I'm like, absolutely.
There is some bikini hair removal regret that happens out there.
Really?
Yeah. And there's nothing you can honestly do.
I don't know.
You should be pretty sure.
I mean, I guess things go through like different phases.
Right.
Okay, the other thing that I've heard about that I am curious, but I know very little. I actually don't even know what it's called. So we're gonna have to do the Ilaria search for what the word is. What's this thing where people take like a razor and they like shave their skin?
Dermaplaning.
What is that, and why do people do it? And is it good? And what are your thoughts?
Yeah, so it is definitely safe. It definitely leaves your skin feeling a lot smoother. So basically, what's happening is a surgical blade, is being very gently scraped along the surface of your skin, so causing exfoliation. Our sort of the feedback I've gotten from patients who get it regularly is that their face feels so smooth, mostly because those tiny little baby hairs are being removed. So for a few days, even that little peach fuzz that everybody has on their face.
Do I have peach fuzz on my face?
I don't know.
Everybody
I have to take a look. Probably not you. Everyone but you.
Everyone in the world except for me. I'm all of a sudden going to like go run to me. I'm like, where's the thing that throws the hair on my face? No, does everybody have hair on their face?
Everybody's got a little bit.
A little bit of hair on their face.
A little bit of peach fuzz.
I have to spend more time in the mirror.
Not having that definitely leaves your face looking smoother. There's thoughts that it's causing little tiny micro injuries on the very surface of your skin that is causing new skin formation, new collagen formation. That is debatable. So if you ask most dermatologists, myself included, I think there's not enough injury that's happening that any sort of permanent improvement's happening. But it does leave your skin feeling very smooth for a few days.
A few days,
maybe a week or two.
No, because you go to like the YouTube or the Instagram videos and you see like these people like shaving
everything's so smooth.
It's also that like satisfaction of like all these dead skin cells that people are like they're showing that are coming off of, and you think like, oh my God, that's on my face all the time.
Yeah, that's kind of the similar concept with microdermabrasions and different types of facials where stuff like that is done. It's very superficial, and it is going to leave you with a little bit of glow. It's going to leave you looking smoother. Great for prep for an event. Great if you're getting married. Great if you need to, take pictures.
It doesn't last very
nothing. You're not doing anything permanent.
Got it. I do feel like we go through phases of what looks good. I mean, you look back in like the 1700s and people like wore these gigantic, ridiculous wigs and powdered their face like very, very matte white. Right now, we are going through a very dewy look. We're all into that youthful glow, which I think is like really fun. But I also don't know if I'm just like caught up in the movement and like, 2 years later, we're going to be like everything matte, powder, gigantic wigs, white powder. The thing that I think about, because I'm like slapping moisturizer on my skin now all the time and different oils and stuff like that. The thing I get worried about is clogged pores. And how do you find that balance? Before it would be like, okay, let's do all these different kinds of like things that have alcohol in it to like dry up anything. And if you get a pimple, just dry it out, put something on it. I know that everybody has a different kind of skin type, but how can we have that dewy look and not break out?
Yeah, so it is, honestly, the answer is a little bit unsatisfactory because it does come down to the individual person.
So give us different types of skin.
So the problem with somebody who has, everybody's kind of thinking more is better. So more hydration, the better. The more oil, the better.
We will be young forever.
And that's really only true for people who have super dry skin.
Right.
If you have normal combination oily skin, what I'm seeing more and more of over the last few years as sort of the moisturizers have gotten a little bit more intense, more powerful, is especially my female patients, I'm seeing lots of patients walking around with little bumps all over their face. It's just not smooth, and that's clogged pores. And you can either, if you love the product, use less of it, pick a product that's less moisturizing. That would be another option. Or just be really, really good about cleansing. Yeah. So at the end of the day, if you've got a lot of moisturizer on, just using an oil cleanser to take that off and calling it a day is probably not enough. You have to kind of get your pores squeaky clean before you put on your next application of moisturizer, makeup, things like that. So I think cleansing becomes very important.
People ask me a lot about what my skincare regimen is, and that's sort of like the daily thing. Like forget about like all the lasers and all different kinds of stuff that you can do.
No, I know. I love watching those YouTube videos or the Instagram videos you put up.
Videos of my makeup tutorials.
Yep.
And I always wonder, because I do feel like my skin changes. Like recently, my skin has been super, super, super dry, and I don't even know why. Probably something hormonal. This is like the first time that I'm not pregnant or breastfeeding in like more than half a decade. So I feel like my body's like, what's going on? So I've been doing lots of moisturizing things, but I'm always curious about masks and different kinds of course, the peels, but stuff that we can do at home for our listeners who can't come to you.
Yeah.
What's like a really good, if you are, wanting that dewy look, and then sort of your nightly makeup routine. Like I will take, mine is probably not good, but I will take a wash, just like one that I get in the drugstore. It's like Neutrogena Naturals, and I wipe off the makeup. So I take my makeup off, and then I'll take a CeraVe hydrating cleanser, and then I do that, and then I put on and then I put on a lot of moisturizer and I sleep like that. But like, should I be doing a mask? I have a mask that's Kiehl's pollutant, taking out your pollutant, some green thing that smells very minty.
Yep.
So I'll do that sometimes. But should we be doing like these pore cleansers? And then you taught me as well about when your skin is wet, taking a rag, like a little washcloth,
Yep.
and gently making circular motions in order to exfoliate.
Yep. So the three things I really like for keeping your pores as clean as possible, besides just basic cleansing, are mechanical exfoliation. So that's using movements, friction, so to cleanse your pores. You can use, like, they make those spinning brushes. You can buy.
But do you like those? Because I feel like I broke out after using.
Yep. So
one.
I think that for most people, they can be a little harsh. So
and I think that they can get
cause skin
dirty no matter
inflammation,
how much
and
you
they
clean
can-
them.
Yep. And that's true with any of those, like loofahs, buff puff, all those things. They can get bacterial, colonized with bacteria very, very quickly. They always do these studies and they show like things you leave in the shower are colonized with more bacteria than almost anything else in your house. And that's tends to be where people store these things. So you do need to be careful with, which is why I always tell patients, just clean washcloth, use it once, call it a day. So that's one thing. I really love vitamin C in general in cosmetic products for a little bit of chemical exfoliation daily. So it's not going to be harsh. It's not going to make you super dry, but it's going to very, very superficially, lightly be exfoliating your pores, so keep your pores open so they don't get congested. That's another big thing. And then masks. So the clay in masks draws out basically the oil, the sebum, and all the other sort of stuff that's gooped up in your pores and draws it to the surface. And that's great as a step to take once a week, twice a week.
Do you have a clay mask that you like?
Honestly, you don't need to go super fancy. I mean, we have one that my own product line, Mod Skin, we have a great Go Greenly mask. It's, again, same thing. Minty, has a little bit of sulfur in it, and clay to draw up impurities. Glytone makes nice masks. I mean, there's so many masks out there. As long as, and I don't think you need, it's honestly the clay that matters more than anything. So I wouldn't get something that has lots of added ingredients and oils and stuff that would defeat the purpose.
Right.
So as simple as possible with a mask. Anything you could pick up in like the cosmetic section in Whole
What
Foods.
about those clay masks that you see and then they like roll it off or they peel it off?
Yeah, so I don't love those as much. So I think they're not quite as effective as just a traditional clay mask because they've added certain ingredients to make the texture so you can do that. And that's fun, but it's not necessarily doing what it needs to do.
It's not necessarily good. What if you have a lot of blackheads?
So blackheads are really tough to treat. It requires continuously keeping the pores open, first of all, and then you have to somehow shrink the pores so that they don't keep developing new blackheads. And really the only things that do that, I mean, there's procedures we can do in the office, but at home, really the only thing that I think effectively does it is retinoids that build collagen, tighten the pores. And not everybody can use retinol.
Is that because they burn?
Retinol can get drying. It can get irritating for a lot of patients. The three main side effects with retinol are, first of all, you shouldn't use it while you're pregnant because it's vitamin A derived. I mean, high doses of vitamin A is toxic during pregnancy. It can be drying. That's the main reason people stop using it. And it can make you sensitive to the sun. One trick that I've found with retinol that can get anybody used to it is ease into the routine. So they're meant to be used every night, but don't start that way. Start out just once a week. Do it that way for like 2-3 weeks. Then do 2 nights a week, then 3 nights a week. So you just keep building until you
tolerance to it.
Intolerant, yeah.
But that will shrink your pores.
It will. So the main that class of medications, the main indications are for the treatment of acne, including blackheads, and then collagen generation, so improving fine lines. And that same collagen generation is going to shrink your pores as well.
Do you find that there really is anything that gets anywhere close to the benefits of Botox in terms of retinol and stuff like that?
In terms
wrinkles.
of like wrinkles on the forehead, around the eyes, no, not even close. Yeah, so just quick, simple, easy improvement. Botox is the quickest way to do it. The sort of, I tell patients the at-home routine is for the skin texture between those deep lines.
Got it.
Yeah.
Now, for people who are, afraid of the harsher things, people they hear Botox and they're like, oh my God, that's so scary. I mean, Botox has been around for a long time, right?
A long, long time. And now there's so many variants of it. There's other brands now as well.
How can people know that they have found somebody who is going to be a good Botox administrator?
So, I mean, there's 2 or 3 specialties in terms of medicine that actually have training in cosmetic procedures as part of the whole training they have to get that degree. Plastic surgeons, dermatologists, and what are called facial cosmetic surgeons, which are ear, nose, throat doctors.
Oh, okay.
You really can't go wrong going to somebody in those sort of specialties because that they've had the training right from the beginning. That was part of what they learned. I would personally never go to somebody to have my gallbladder removed if they learned it in 2 or 3 weekend courses.
Not good.
Right. I would want them to have done it as part of their general surgery training. Right. In the same vein, I wouldn't want somebody operating a laser on my face and potentially burning me or sticking me with Botox or fillers or treating my leg veins or any of these things if they haven't had training in that.
Because you see examples every day of people who either went to somebody who wasn't good, went to somebody who didn't know how to say no. I feel like in your profession, you have to be able to be somebody's mirror and somebody's sort of advocate and be like, yeah, you don't want to do that.
Yeah.
No, you don't need more lip filler. No, you don't need more cheek filler. No, your face needs to move a little bit.
Right. I mean, that's the thing. You do need to know when to stop. And I got reminded of that when you said everybody wants to look more and more and more dewy. Mm-hmm. Now we have patients that are so addicted. Of course, we're not getting them to this point, but they come to us wanting like a resurfacing procedure. And their face is already so tight and shiny. There's no lines, there's no sunspots, but it doesn't look natural.
Right.
And, as human beings, we are continuously evaluating all the other faces we see around us. That's part of our nature. That's how we get attracted to somebody, feel danger from somebody, all that stuff. We look at expressions. And if something's unnatural, that's going to strike you more than them looking a little old or having a few lines. A few lines still looks natural. You can still see beauty in that. When somebody looks plastic, that kind of sends all these warning signals in your brain. Something's wrong here with this person. This is not looking normal. So I think it's a big danger to want more. It's definitely a less is more sort of field, cosmetics.
Well, one of the things I love about you is that you really are very focused on that there's no fountain of youth. It just doesn't exist.
Nope.
It doesn't exist. And we're all supposed to get older. And we're all supposed to, have expressions and have emotions and have this and have that, supporting your body and, making it sort of last and be fresh for as long as possible. Absolutely. But we only go in one direction. And this whole idea of like, we're going to reverse aging and it's going to go backwards and you're going to look like you're 20 years old. You're just going to look scary.
We are 100% with all these procedures fighting nature, and nature's going to win this battle in the end. And we have to kind of let it win it gracefully and slowly. Right. We're gonna slow it down.
But the word is graceful.
Yeah. But this is not a fight you're going to win against nature. So it's futile to try, and it can end up looking disastrous.
Okay, so talk to me about your skincare line, because when you go to visit Dr. Akhavan in his office, he's like a mad scientist sometimes. He's got you see beakers and all these different things, and he works so hard, is often there till late in the night, and he's just trying to perfect this and has such a as opposed to some people who literally slap their name on a product that somebody else has made. You really want to own your products and feel really good about it. So what's that process like? And talk to us about what your skincare products hold.
Yeah. So my together with my business partner Alyssa Di Benedetto, we've been kind of working. Our goal is to have a product line that's filled with natural ingredients, hopefully one day only natural ingredients, that still feels like some of those products that you love, like the CeraVe, the Neutrogenas of the world. That's kind of it's been very difficult to process. We're very close. We actually have lots of products we're very hopeful with in their final stages of testing. So we're very close, but that's what you usually see me working on. What I find is with natural products, a lot of times you'll go into a health food store or look online and the ingredients sound so exciting, but then you get it and it just feels like literally olive oil,
right.
And you're like, I can't walk around with this on my face.
Right.
It's not, it may work for somebody, but it doesn't work for 99% of people.
Right.
Versus you put on that CeraVe moisturizer, you put on your La Mer that has some natural ingredients, but also has a lot of ingredients you can't pronounce. And it feels so smooth and silky and makes your skin look so good. And it's kind of a trick to get those two things to kind of work together. So that's what we're working on. We're trying to get products that go on the skin feeling like the creams that you're used to, but have ingredients you can pronounce and recognize and no mystery about them, and that they're all natural.
And that's definitely, I'm in a journey to get more and more natural. I mentioned Neutrogena and CeraVe, and these are, some washes that I'll use. I also have like Tata Harper and stuff like that. And so I'm kind of experimenting with different things, and it is that sort of battle of, okay, I want to use things that you could essentially eat. They say don't put anything on your skin that you wouldn't actually eat.
Yep.
But you want it to work.
Yeah, and it's not even just consistency. It's you want it to be absorbed into your skin and actually do something.
Right.
So it's, yes.
Because otherwise, what's the point?
Rosehip oil is great, and it is actually anti-inflammatory. But if you just take some rosehip and rub it on your skin, it's just sitting on top of your skin.
Right.
So we have to get it to penetrate, actually have its anti-inflammatory effects. Some things that you can look to right now that are sort of ingredients that still feel great, but actually are naturally derived. I love my sort of big things I always tell my patients, besides the obvious of sunscreen, is hyaluronic acid and serums that contain hyaluronic acid. That's a natural component to our body. It's a humectant, meaning it draws water to itself. So you put it on your skin, that word dewy again that you used, it creates that dewy skin by drawing water from the environment to your skin, plumps, so you get some immediate hydration and benefit. And it's anti-inflammatory as well, so some long-term improvement. Vitamin C I mentioned, besides the fact that it's exfoliating every day, it's anti-inflammatory, going to help with sunspots, and because of that has anti-aging benefits as well. Another great ingredient, the CeraVe you mentioned has this, is niacinamide, which is derived from vitamin B3. Anti-inflammatory, helps with acne, helps with rosacea, helps with skin inflammation, helps with perioral dermatitis, all those little bumps I was talking about that sometimes women are getting from a little overhydration with products. That's another great thing. I mean, there's stuff out there that works. It's just there's so much stuff out there.
There's so much stuff out there. There's so many options, and you're like, oh my God, which one should I do?
So that's kind of where we are with our product line. We right now have sort of a mix of things that we like that derive from natural ingredients, but our goal is by 2020 to be an all natural product line, which time will tell.
Well, the clock is ticking because I literally know that when you're happy with a product, it literally is going to be perfect because you are constantly tweaking it for like a really long time, like years. Years you've been working on this.
The ones that we just sent off for stability testing, you and I were talking about maybe 2 years ago.
No, I'm very excited. You're going to see like my shelves are like only your product line once these actually come out. It's going to be like pure perfection. I've been asking questions that that you guys wrote to me on my Instagram this morning, because I said that, everybody, we had Dr. Akhavan on a few months ago, and you guys all loved him so much that he is our first guest who has come back for a second one.
Wow, I'm honored. I didn't know that. Wow,
you're our only guest who's come back for a second one because
gosh.
you guys loved him so much. So I've been trying to ask all the questions that you guys have been texting me to ask. We do have to let him go in a few moments, but I do want to get a stretch mark quick. I probably will have another baby at some point. What should I be doing during? I feel like I've been playing with fire. I have no stretch marks yet, but if I have a fifth child,
Well,
that
hopefully
going
not.
to be
You have superhuman skin. So yes, the more pregnancies and the higher the birth weight of the babies, the higher your risk for stretch marks. Genetics definitely plays a role as well. There's lots of myths out there about use this oil versus that oil.
Palmer's cocoa butter.
Yeah,
That's what my mother
right.
told me.
Yeah, that's what everybody's mother told them. There's no evidence that shows that one form of moisturizing works better than the other, but moisturizing in general probably does help. So not letting your skin get over dry just increases its elasticity, allowing it to expand a little bit more. Afterwards, it's all about sort of trying to repair, trying to get that collagen that's been
And it
stretched
takes
out.
a while for it to come back. I mean, I even
Yeah.
noticed my son just turned 1, and I've been noticing even recently my skin is starting to get tighter. It's a process. People
Right,
get
it
frustrated.
is.
They're like, okay, the baby's
No,
out, and 2 months later,
you
they're...
need to be patient. I mean, it is pretty amazing how well the body can bounce back. It almost never bounces 100% back, but it is amazing if you're just patient and just give it time. A lot of that pigmentation that you don't like disappears. Breakouts and hormonal things can go away. Muscle strengthens, skin bounces back. So yeah, patience is a big part of it. And then there's things you can do to kind of regenerate the collagen that's been lost in the areas you have stretch marks. So some of those same procedures we talked about, the lasers, the microneedling, they've all been shown to help
You can
improve.
microneedle your belly?
You can? Yeah, definitely. Yeah, so we do that all the time. It's the same process it is for the face where we're treating fine lines. It's all collagen that we're trying to generate. So whether it's fine lines, acne scar, surgical scar, or a stretch mark, you're in the end going to use the same process to try and get that to occur.
And they have this microneedling with like some special something in it, some like magical lotion. I've heard, again,
Yeah.
this is all is like stuff that pops up on my Instagram. I'm like, what is this new magic?
Yeah, we try. I mean, one of the most popular things we do is PRP, platelet-rich plasma. We draw your blood.
Is this the
spin
vampire
out-
facial?
Yeah, that's what some people call it. We draw your blood. We isolate the platelet-rich plasma, which has all the growth factors in it, and we introduce that as we're microneedling. That's how the microneedling works in the first place. It's poking holes that are getting your body to release its growth factors. We're going to supplement that with the PRP, and it boosts the results. There's no studies with PRP, unfortunately, showing how much it helps.
Right.
So it's all kind of guesswork. In my experience, I do think it makes a difference when we add it, but it's definitely not necessary. You can do the microneedling alone as well.
And for people, I mean, I am a news junkie, so make sure with any of those kinds of things, any of these things, period, but like especially when it comes to your blood, go to a good place because there are so many like horror stories.
I know. I saw that recently.
Yeah,
there
the
was
guy
some.
gave HIV to a lot of
That's
his
what I
patients.
heard. Yeah, I saw that on the
But
news.
that's the thing
Yeah.
is like one thing I've always like I'll caution people like don't buy any of these procedures on Groupon. Like
Right.
bad idea.
Yeah.
Princess Groupon. Like I microbladed my eyebrows recently and like I love it.
Mm-hmm.
And then I gave the gift of eyebrows, as we call it, to one of my friends, and she sends me this like article about this woman who left with 4 eyebrows from microneedling, but
Yeah.
she also got it for like $100 on Groupon.
Yeah.
And I'm like, that won't happen to you because we did not buy this on Groupon.
Yeah.
And again, these things that we want to play around with, they can be expensive. And so it's kind of, but you have to take it seriously. You have to take it seriously. And, you know, as much as we always want to find sort of a shortcut and make things more accessible and stuff like that, is you really want to take care of your body. And your body, just as you are, is way more worth it than you going and finding somebody who's not very good and them making a big mistake that is going to eventually cost you more money and pain and maybe a
Exactly.
lot of
Sometimes
tears.
it's better just to not do it.
Just not, because
Yeah.
maybe you are beautiful
Yep.
just as you are. And he is the only person who has come back for a second round.
That is truly an honor. I had no idea. Thank
no,
you so
it's
much.
so exciting.
Thanks so much
We're
for
going to
having
have
me.
to do a third version
Thank you.
too.